Okay, so now let's go into our case study and give you a reminder of the case study. We are in rural Tanzania, and syphilis in pregnant women account for many adverse pregnancy outcomes. Unfortunately, even though the country has a policy to screen and treat women against syphilis, more than half of the facilities don't have the capability of doing it. And decision makers want to improve pregnancy health outcomes in clinics with no testing capacities. And so let's go through those steps that we talked about earlier as far as framing the study and show how we would address those steps with this case study. So who's our audience? So our audience could be a number of different people. Clinic directors, Ministry of Health, the public, pregnant women, donors, but we are looking to provide an answer to the Ministry of Health because they're the one that's going to use this data to decide if they're going to start screening and treating women in these rural clinics. Define the study question. Should antenatal clinics start screening and treating pregnant women for syphilis in rural Tanzania? Okay, relatively simple. Identify the intervention options. We've identified a number of them earlier. One is the status quo, in which we continue to not provide screening and treatment for women with syphilis. Screen and treat women against syphilis, and there's many ways of doing this. Or just treat all. Any women that come into the clinic, we just provide treatment to them. What perspective are we looking at this from? Are we looking at it from the clinic managers who's going to be putting this into operation? If this was the US, probably, but this is not the US. It's going to be mainly the government, the Ministry of Health. So that's a perspective that we have to think of as far as the cost and the outcome. We could look at it from the patient perspective because for a number of patients, there's really a big burden. Not only the burden of getting to the clinic and receiving the care, but it could be side effects from the medication, and it could be side effects from having a child born with congenital syphilis. There could be some disabilities, some long-term learning problems. The child could die, the mother could have some emotional stress. But since we're looking at this from the government perspective, we don't need to think about that or collect any of that data. You would if you want to have an emotional response to the decision maker, but ultimately they're going to make the decision based upon their own perspective and not strictly on the patient's perspective. So define this time frame and an analytic horizon. So as far as the time frame, we assume that we're using the existing clinic and we may have to pay for rent for additional space to have this program. We have to be concerned about the staff, supplies, and maybe some advertising. And those costs will likely occur for an entire year, or it'll occur continuously. But we'll just leave it at a year. As far as the analytic horizon, there will be costs occur for every patient, if they get treated or not. The benefits are likely to be noticeable within a year. You're going to have women who become pregnant at the beginning of this program, women who are delivering at the beginning of the program. But either way, you should start seeing outcomes within 9 months. Ideally, probably 2 months, but you should be able to see some type of outcome within a month, within a year. I think I misspoke. So ideally, we would like to have it over 2 years, but we should be able to see outcomes within 1 year. So that's going to be our analytic horizon. So our time frame and analytic horizon will be over 1 year. So start thinking about the next steps. So we need to start thinking about the economic evaluation we're going to do. So will we do a cost effectiveness, cost utility, or cost benefit analysis? And again, it's really going to depend upon what our outcome measure is going to be. We need to be able to measure the cost. We need to do our cost analyses, determine what type of health outcome we are going to use. And then we're eventually going to start building the model and identifying the data that's needed for the model. And then at the end, we conduct our sensitivity analyses, and we'll talk a little bit more in detail about sensitivity analyses.